Ready to test your Med-Surg knowledge? These NCLEX-style questions will challenge your clinical judgment and prep you for the real thing. Let's begin. Which electrolyte imbalance is most commonly seen in patients with renal failure? Answer: hyperkalemia. Which sign is a classic symptom of left-sided heart failure? Answer: pulmonary congestion. What is the priority nursing intervention after a thyroidectomy? Answer: maintain airway patency. Which condition requires airborne precautions? Answer: tuberculosis. Which assessment finding indicates a possible deep vein thrombosis, DVT? Answer: unilateral leg swelling. What should a nurse monitor in a patient taking furosemide? Answer: potassium level. Which lab value is expected to be elevated in pancreatitis? Answer: amylase. Which position is best for a patient with increased intracranial pressure? Answer: head of bed elevated 30 degrees. What is the priority action when a chest tube becomes disconnected? Answer: submerge the tube in sterile water. Which symptom is associated with Cushing's syndrome? Answer: moon face. Which finding is expected in a patient with right-sided heart failure? Answer: peripheral edema. What is a serious side effect of ACE inhibitors? Answer: angioedema. Which medication is used to treat myasthenia gravis? Answer: pyridostigmine. Which type of precaution is used for a patient with Clostridium difficile? Answer: contact. Which organ is affected in hepatitis? Answer: liver. What is the most reliable method to confirm NG tube placement? Answer: X-ray. Which symptom is typical in appendicitis? Answer: right lower quadrant pain. What is the first sign of hypoxia? Answer: restlessness. What is the priority nursing action for a patient with suspected stroke? Answer: assess airway and breathing. Which is a sign of hypocalcemia? Answer: positive Trussell sign. Which test confirms a diagnosis of tuberculosis? Answer: sputum culture. What is the best indicator of fluid volume status? Answer: daily weight. What is a sign of digoxin toxicity? Answer: visual disturbances. What lab result indicates poor kidney function? Answer: elevated creatinine. Which dietary choice should be avoided by a patient with hypertension? Answer: canned soup. What is a late sign of increased intracranial pressure? Answer: widened pulse pressure. Which is a symptom of peripheral arterial disease? Answer: leg pain with activity. What is a potential complication of prolonged immobility? Answer: pressure ulcers. Which lab value is most concerning after surgery? Answer: WBC of 20,000. Which action is priority for a patient with low oxygen saturation? Answer: raise the head of the bed. Which symptom is associated with diabetes insipidus? Answer: excessive urination. Which sign indicates fluid overload? Answer: crackles in lungs. Which finding is expected in hypovolemic shock? Answer: tachycardia. Which position promotes lung expansion? Answer: Fowler's. Which intervention helps prevent atelectasis? Answer: incentive spirometry. What is a common side effect of opioids? Answer: constipation. Which condition causes pain in the right upper quadrant? Answer: cholecystitis. What is the most common cause of peptic ulcers? Answer: H. pylori. Which sign is associated with hyperthyroidism? Answer: tachycardia. What is the main symptom of anemia? Answer: fatigue. Which type of incontinence is associated with laughing or coughing? Answer: stress incontinence. Which lab value indicates infection? Answer: elevated 1B. Which dietary choice is high in potassium? Answer: banana. What is the purpose of a PCA pump? Answer: pain control. Which complication is common with total parenteral nutrition, TPN? Answer: infection. Which condition requires seizure precautions? Answer: epilepsy. What does an elevated troponin level indicate? Answer: myocardial infarction. What should a nurse do before giving a beta blocker? Answer: check heart rate. Which patient is most at risk for skin breakdown? Answer: immobile elderly patient. Well done, everyone! If you enjoyed this quiz, don't forget to like, subscribe, and hit the bell for more fun challenges. Thanks for playing, and we'll see you in the next quiz.